Well, we are sitting here having a cold glass of water, talking to a lady that I believe, Mary Ellen, I found someone that can out-talk me.
I think you're right.
Mary Ellen Krydynski. Krydynski. That name is almost like my Pellegrina. You have trouble with this, our last names, I'm sure. But anyway, we've talked so much. I feel like I already have done a whole program with you because you have led a very interesting life. And I was told you must get Mary Ellen Krydynski to talk to you about her life as a family nurse practitioner. And so here we are. We're going to, first of all, this was kind of a new expression for me. Exactly, just bottom line, no details about but I'll get to this later. What is a family nurse practitioner?
A family nurse practitioner is someone that has an advanced degree in nursing. We're trying to do the role, or to be in the role, where physicians can't go into the rural areas or the inner city. We do physical examinations. We prescribe medication. We order tests that need to be taken, lab tests or MRIs or whatever the patient needs. We follow up. When we find a serious problem that needs medical intervention by a physician, we refer that person to the appropriate doctor.
So you actually diagnose then, can you?
Oh, yes. And we treat chronic disease. And we're kind of, I've always thought of us as gateways into higher levels. You know, somebody comes in and they have aches and pains somewhere. They don't know what specialist is needed often. We do. And that's what we do, that's when the doctors come in.
Did you ever think about going on to become an MD?
Well, I never did. And the reason was that nurse practitioners concentrate on educating the patient so much. We get a lot of nutrition classes when we're taking our degrees. We do a lot of patient education, teach the patient to care for themselves so that they can be their own taskmasters, so that they don't have to see a medical provider as often. They know, for example, with a diabetic, they know what kind of a diet they have to be on, they know what to do for themselves, they understand their insulin, so they can take better care of themselves.
Why aren't there more people like you?
Well,
that's throwing you a curve, isn't it?
It's strenuous. There are up north. I came from Chicago, and in 1981 came to Spartanburg, South Carolina.
Were you born in Illinois?
Yes, born in Chicago. Born and bred in Chicago. And our children were raised in Lansing, Illinois. And my husband was transferred here to begin the R.R. Donnelly plant in Spartanburg. So we moved there, and I wanted to go back to work. And was one of the only women in my neighborhood that worked. Everybody else stayed home, and I went to work. And I couldn't find work because no one knew what a nurse practitioner was in those days. So finally, I spent a year and a half at Mary Black Hospital, and then I went to DHEC.
Where?
Department of Health and Environmental Control.
Well, it's another one of those agencies the government has that just go by initials. I'd never heard of this.
Oh, it's the health department.
Okay. Now that I understand.
Right. So I went there, and the medical director there was wonderful. We wrote all of the protocols for nurse practitioners to come. So I was one of the first of many to follow me of nurse practitioners. I'm a dinosaur. In the 1970s, this medical degree was started in Colorado.
Is this kind of that date, 1970? Is that when that first came into its own?
Right. And
that's not that long ago.
No, I got my degree in the 70s.
Where did you get your degree?
At Purdue University, Prairie State College and Purdue University. There weren't many, and there still aren't many, but there'll be more to come because of the economical situation with medical care today for the patients and for the providers. I think you'll find more and more in the entry level, like family practice, you're going to see more nurse practitioners available.
What's the difference between a nurse practitioner and the physician's assistant?
That's a good question.
Oh, I thought it was kind of good.
Excellent question.
Okay.
First of all, I want to make clear, it depends on the schooling of the nurse practitioner and the schooling of the physician's assistant. And often, it's my understanding, they came from the Corps during the war. They were corpsmen in the war and learned medical techniques and came out, and physicians hired them to be their assistants. In those days, they couldn't prescribe medicines, although they do today.
You can prescribe medicine?
Yes.
Oh,
yes. But they, it's, again, my understanding, and you'd have to talk to a PA about that. And Janet Howell would be an excellent person to talk with.
She told me about you.
Oh, she'd be an excellent PA to talk with. I hired her, and she started out as a nursing assistant. And,
oh, really?
And her education, her curiosity, and that took the best of her. But she didn't have a medical background, so she had to become a PA. Nurse practitioners have to have medical background. They have to have a baccalaureate degree in nursing to become a nurse practitioner, because that's added 2 years more, and it may become a doctorate level. They're discussing that now. So anyways, the PAs were assistants, and we could stand alone. We don't need to have intervention from the physician. I worked for many years in Slater and Marietta, South Carolina, and my closest physician was 16 miles away. So I wasn't used to working with a physician. I've always worked, on my own, and it wasn't until my husband bought G&K Furniture Store in Columbus, and we moved up here. And
now, what year was that you came to Columbus?
I think it was about...
it's not important.
Maybe 16 years ago. I'm not sure now. Yeah. We came to Spartanburg in 1981, so I'm not sure exactly. And he bought the furniture store, and I went to work at the hospital clinic, St. Luke's Clinic. And after a while, Dr. Weyer came, and we talked and went to the hospital and to the CEO and suggested that we buy the clinic from them. And it was the first time that a nurse practitioner in the state had owned a medical clinic with a doctor.
Now, this is the clinic that's here in
Columbus
now?
Yes, Hills Medical.
Okay.
Yes, with Dr. Weyer.
Yeah.
And I did that because he was highly ethical. He saw the patient as a total human being, not just the ache or pain they came in with or the problem, but he saw the entire individual. And he was more in line with the thinking of a nurse practitioner.
Of yours, yeah.
Right. He's very open, and he's just a really good doctor and a good man.
We're so fortunate here in a small town. I said we have more horses than people here in Polk County, but and we have good, horse doctors, or not horse doctors,
right.
Veterinarians. We have great vets also, and but I said it's unusual the quality of care we have here, including our hospital, the clinic, the doctors we have, and if it's something beyond their scope, occasionally there are things, because we're not a big hospital, multi-level, but we're expanding. We have a big growth on now, and it's unusual for a town of this size to have the quality health care that we have, and I'm sure you recognize that right away.
Well, that has changed in the last few years, I'm proud to say, of this town and of the hospital. And I think a lot of that improvement can be directly related to Ken Shull, the CEO of the hospital. He has come in, and I was recently a patient myself, and I observed that he would go, for example, into the ER and sit down and talk with the doctors.
He knows
there.
people by name, too.
Yes. Exactly, he does, and he remembers. And he would go into patients' rooms and talk with patients. He was the kind of CEO that didn't sit in his office. He was a good boss. He went and found out what the people that worked under him or for him thought, and what their actions were, and how they were doing their job, and what the problems were. And when he found a problem, he corrected it immediately.
He was one of the first people I did when we started doing these voices of the foothills, and we're going to do more because there's so much going on at our hospital here, and it, of course, is an integral part of the growth. It's not, Polk County's not going to grow into a metropolitan area or anything of that sort, but it's not going to stand still. It's not going to stagnate. And I think one of the prime things we notice about that is the health care that's provided people here in the area.
I think you're right. And I think that getting back to nurse practitioners, I think
that's what we came to talk about. What? We digress.
But getting back to nurse practitioners, I think the important thing, and the thing that makes me so proud, is that I've watched, I think the people who started this, the dinosaurs, stood firm and had broad shoulders, broad enough that those that came behind us could stand on them. And they did. And they have continued to improve, stay with medicine, be true to it, be true to the patient. And I'm so proud when I see the nurse practitioners of today. I've done a lot of teaching with Clemson and that, and the nurse practitioners would come to me for training in the clinic situation. To see their improvement from the early days of what they know and what they're taught, the depth of their education, makes me so proud. A couple of years ago, I was the year I retired, which was 7 years ago.
Oh, you're retired?
Uh-huh.
You're a busy retired.
Well, I'm a busy retired. But 7 years ago, the year that I retired, in fact, the same month, I was given a national award for the the best nurse practitioner in the state of North Carolina.
Really?
Yeah, and that was really, it was an affirmation to me that I had done what I should have done, that I did my role properly. And I remember I used to pray every morning driving to work, please, Lord, don't let me kill anybody today. And I did. But it's an honor. It's an honor to take care of people.
Why, with all this knowledge that you have, and as you say, you're just a shade under what the doctors do, cannot you be honored with the title doctor?
No, I never wanted to be a doctor.
You don't, but I mean, it seems to me it deserves more than just Mrs., Krydynski.
Well, I think there's a couple of reasons. First of all is the financial cost to the physician going to medical school as compared to the nurse practitioner going to school. We don't have the fees, the medical fees that the doctor has. We have postgraduate fees, and that's it. Yeah. That's one thing. Another thing is the focal point. Nurse practitioners focus on education. We're very strong in educating. And when was the last time a physician, took 45 minutes to educate you?
I see. I begin to see something that I hadn't, when I first heard about what you did. I'm seeing a difference now, because very often we hear people complain when they go to the doctor, and the doctor has people one after the other, right, all day. I don't know how they do it with all these illnesses. I'd get ill myself after one day of it. But I can see now, because he doesn't have time maybe to explain all of the things that right, you do. So you're the next step.
That's what I said. Often we're the gateway to the specialist. Yeah. Family practice is there's so many financial hardships now for family practice doctors. Running the clinic, keeping things going, paying everyone's salaries.
And what about the federal interferences? Has that made a difference?
Well, yes, and primarily financially. They're not being reimbursed from the government for Medicare and Medicaid with the right amount. And we're having, and especially in a community like this, we have so much Medicare because of the aged population. So the physicians have to do a cutoff of how much they can do. Otherwise, they can't afford to pay their bills, because Medicare and Medicaid reimbursement is so poor. Yeah. And they really struggle with that. We struggled with our practice, of making sure those doors stayed open, and yet knowing our reimbursement was slow coming back, and it was not what we would want it to be. So you're finding more nurse practitioners. We don't make the salaries the doctors make. You're finding more nurse practitioners going into these roles in the primary clinics, and the men that are in medical school, men and women that are in medical school, going on to specialize, in that way. And I think that's appropriate. Yeah. I think that's appropriate. But
they'll call back or leave a number or whatever. We're almost here. We'll just let it ring. Hello. Anyway, this is one of the little distractions, but it doesn't make any difference. We're a very informal program. Okay. I'm going to wind down here in just a minute or two, but I just wanted to say or ask you to kind of summarize with what you've done with your life, and what do you. Let's rephrase that. Would you do this all over again?
Oh, in a heartbeat. I have met and continue to meet, whether they're in the grocery store or church or wherever, I have met the most wonderful people in my life, whether they've been my peers or my superiors or they're my patients. I have met extraordinary people. I have I've been proud of my profession. I'm proud of what I accomplished.
You should be.
We should be. All of us should be. I'm an old lady now and retired, but I'm proud of those that have come behind. I'm proud of the standards that we set in the 70s. I'm very proud of that. We had our eye on the stars, and we've been able to encourage and nurture those that came behind us, and I'm so proud of that. But it's the people. It's the people that you meet, and I was so fortunate. In a medical setting, you get to meet lots of people, lots, and my husband has always supported me, whatever I've done. And I had a call the other night, and he said to me when I got off the phone, a medical problem, and he said, "You're retired." I said, "I don't think you ever retire."
You don't retire from something you love.
Right. And it's been, I would do it in a heartbeat.
Good. Well, I can see the light in your eyes when you talk about it, and I hope that maybe if there's any young lady who happens to catch this program, that you will kind of listen to what she's saying. If you're not knowing exactly what you want to do with your life, think about something like this, because just think of the lives that you have saved, influenced, or whatever. You've led a useful life, and I hope it continues. Don't retire from living. That's the thing I like about Polk County. People retire here, quote unquote, retire. And they're busier than they've ever been. They contribute of their talents. Very often when we need a little money, they kick in with that. And or they give of their time, and it's just full of volunteerism. And I'm sure that you'll, once you get over this horrible, we'll have a program just on your this fall you took. This is a story in itself. But it's been so much fun to sit here at your kitchen table in this beautiful apartment or home of yours. I feel like I'm in a tree house.
Well, thank you. Thank you very much. It's been a pleasure, and I appreciated the time to talk about nurse practitioners, and I hope that there is somebody out there, man or woman, that would become one. And, we're finding more and more men that are coming into the role now also, and it's a role they'll always be proud of doing and be rewarded.
You're contributing something like life-saving. Right. Well, I don't know that I've saved any lives. I talk people to death, so you'll have to revive them. But it's been so much fun, Mary Ellen Krydynski, and a family nurse practitioner. I've just learned so much today that it's nice to talk to someone when you can learn something, isn't it? And I've learned a lot from you today.
Thank you.
And most of it, I think, is your dedication to your profession and your love of it. And your love of people, it's just been great. So, hey, give us a tune again. Stay, click on to the Tryon Daily Bulletin website, and click down where it says Voices of the Foothills, and you'll hear more people like Mary Ellen Krydynski, and we'll maybe have her back again sometime. I'm sure she has a lot more to tell us about this interesting career of hers. So we thank you for being with us, and until the next time, this is Deanie Pellegrin saying, have a great day.